With COVID-19 testing well underway and the necessary tools in high demand, one group of problem solvers is using 3D printers to produce a needed supply of testing swabs.
And we identified early in the process that the collection kits for testing COVID patients were on short supply.
An engineering lab on the University of Missouri campus is helping MU Healthcare keep up with testing. Michael Apshare watches as the solution is taking shape.
And these happen layer by layer by layer over a 12 to 14 hour period.
3D printers are programmed to heat up resin, molding it into coronavirus testing swabs. The swabs are hung in a heated infrared chamber for curing. Then they're tested. A machine applies force to make sure finished swabs break under the correct amount of pressure.
The reason to break the swabs is to make sure they're not too soft and too bendable, or they're too stiff and brittle.
5 3D printers can produce 1,000 swabs a day. It's a collaboration that's already paid off.
It's really neat to see everyone pull together. We identified a need, we're able to find a solution.
The innovation is helping providers stay ahead of the demand for testing so the state of Missouri can better track the spread of COVID-19.